Hey guys, so I want to tell you a little bit about Heal Yourself and how it got started. So Heal Yourself is this pretty awesome program, and it kind of all started with COVID, right? So COVID rocks the world, and I'm a trauma professional, and now I'm a certified trauma professional, and what I saw was the entire world about to change and shift and rock everyone's world. And it is, the world's entirely different. And what we saw happen during COVID is we saw trauma significantly go up. We saw mental health significantly rise, domestic violence, child abuse, all of these things that are taking place in our society every day went up because now people are in close quarters. So I knew that there was going to be a call to need better skills, to need better training, to need better education on trauma in general. But when I developed this program, it kind of happened out of my mentor and supervisor at my private practice saying, I want to put a DBT program together, and I also specialize in DBT, and I love it, and it's one of the most effective evidence-based approaches there is out there, originally meant for suicidality, and now it helps with eating disorders, substance use disorders, major depressive disorder, and borderline personality and other personality disorders. So why wouldn't I use that as the core focus of my program if it's so effective? But as a trauma specialist, I also recognize the importance of processing, and I am a huge fan of cognitive processing therapy. So I figured, how do I integrate all of the best evidence-based approaches in a systematic way so that we can effectively process information and work integratively, starting kind of with a bottom-up approach, but then kind of going back and forth between body and mind to integrate top-down, bottom-up. So we're kind of meeting in the middle. So a person starts off the program learning skills to regulate themselves, developing their subjective units of distress scale, and learning how to regulate that back down, but also now doing this thing where we're starting to examine from a cognitive perspective, and then we're starting to really challenge maladaptive beliefs and thought processes. And then we're starting to do things like somatic experiencing and getting into the body, doing things like biofeedback, emotional freedom technique, and many other evidence-based techniques that I tend to use throughout this therapy program. And then the most important thing that we learned is boundary setting and communication, right? How to effectively learn healthy boundaries in life, to know what you need for yourself and recognize that. So there's a lot of mindfulness built into the program. There's a lot of beautiful skills that teach a person not to rely on their therapist for the rest of their life, but to rely on the skills that they have within themselves and within their body every single time of the day. And I think that's the beautiful thing. I don't want to be a therapist that's needed for the rest of anyone's life. My goal as a therapist, as an evidence-based psychotherapist, is to train people to live a beautifully skilled life so that they never need me again, right? So that they can pass on that education and that information to others. What I did notice when running this program, because I know, you use your partner as a test dummy at first. So of course I used my fiance as a test dummy at first. And I ran through the program with him. And he said, I don't like the word trauma. It's very triggering. And I recognized this flaw that the program would have, is that it would only apply to people who identified their trauma, right? We don't identify those little stressors every single day as trauma responses or like traumatic things, but over time, when beliefs get compacted and events continue to happen, that stress builds and builds and builds. And whether it's coming from an acute trauma that's happening immediately, stress has the same physiological effects as trauma on the body. So we reworked the program so that it would treat any stress disorder, where it's not just addressing PTSD symptoms and reducing that on a PCL5, or reducing generalized anxiety symptoms on a GAD-7, or reducing PHQ-9 symptoms in depression. And we're seeing that improvement in boundary and communication with personality disorders. But we're seeing like it being able to improve any human being's life who needs better stress management techniques, who needs better communication skills, who needs better regulation skills. And it all starts with the simple approach of mindfulness and loving kindness. It all starts with developing a plan of action for yourself moving forward. And it starts honestly with an affirmation. The first thing that I run through with someone is choosing an affirmation, and I give a couple of different choices there, but they're not doing this thing where they're like positive affirmations. They're affirmations that can really change because of their neutrality, right? If someone is innately falling towards the negative, right? And then they go from like, I'm a bad person to I'm a great person. Guess what? You stand in front of the mirror and say that, and your belief system actually says you're a bad person. That's not going to be easily integrated. You're going to look at yourself in that mirror, you're going to say that information, you're going to roll your eyes at yourself, and you're just not going to buy into it. So saying things like, I'm going to let go of what no longer serves me. You know, I'm going to find wisdom in this moment. Those are things that are neutral but positive, and they're not conflicting with the belief systems as we start to work and build on shifting beliefs that don't serve. So I encourage everyone to take a look at the Heal Yourself Therapy program on my website. If you have any questions, do not hesitate to ask. It's been copyrighted since March. The first adult cohort, it just finished, or is just finishing next week. So really it's the next couple of sessions with them is just the processing, but the data is showing great improvements. The kids and the teen and adolescent program will be done at the end of August. So we'll have the results from that study there, and I'm launching another family program in September. So as I'm collecting the data, going through these different group studies, what we're going to see is we're going to collect it to see what disorders does it help, what symptoms is it improving the most, is it helping ADHD more than anxiety, how many points on a DSM symptomology is it decreasing? How many points on a PHQ-9 or how many points on a PCL5 is it decreasing those symptoms? And we're going to want to take that data and continue to run with it and build other clinicians and teaching them how to run it so that eventually this Heal Yourself therapy program can heal many more people. I've started doing this with my cohorts already, where if they miss a session, it's okay. I have everything pre-recorded so that they can learn. It's so adaptable. It's all mindfulness based. So if a person misses a session, or if a person feels like they're falling behind, there are the tools there to adapt for them. You know, the thing about therapy that is always just so mind-boggling to me is how so many therapists do this thing of selecting one approach to focus on. I'm just going to be mindfulness based. I'm just going to be DBT based. I'm just going to be CBT based. And they limit themselves because sometimes it's not just one size fits all. Sometimes you got to figure it out. So I go through many different body approaches, many different thought approaches, many different emotional approaches, many different breath approaches in order to help a person choose what skill is right for them. Because you never know what skill, in what order, in what situation is going to benefit you the most. So I encourage you as clinicians to ask questions. I encourage you as potential patients to ask questions. I encourage you guys to do the research and to figure out what skill works for you, because at the end of the day, you're your own best expert. You know what's right for you moving forward. So I invite you guys to kind of explore that. Don't hesitate to email or call asking questions or inquiring about the program, or just inquiring about what other therapy strategies are out there that might just benefit you. So with that, I'll see you guys soon.